Today we're going to be hanging out with Dr. Kennedy Omondi. He's an advanced wounds specialist. Welcome to the show.
Thank you so much.
So, advanced wounds specialist. What does that mean? Daktari, like, unajua, we don't really, when we think about, doctors, unafikiria ile kawaida uko na homa, sijui uko na nini, but, your specialization is really interesting. So, advanced wound specialist, please talk to me about it.
With advanced wound management, it's a different and an advanced field, whereby you use science when it's coming to wound management.
Right.
In comparison to the older methods, you just go to the hospital, now show to some very fast, rapid goes through these old methods, betadine, the solutions being used. So this one's to employ science.
Okay.
And the whole idea is to make wounds heal quicker.
Okay.
Because by itself, wounds are really limiting. It cuts your life off from a lot of stuff.
Yeah.
So when you make them heal quicker, then it's the way to go.
So using science.
Yes.
All right. So how did you get into it? What school did you attend? Because I'm sure there's someone who's like, hold up, wait a minute. This is something that I can actually do. So how do you become an advanced wound specialist?
It started by a sad beginning because I lost someone close due to negligence in a facility.
Right.
And I wouldn't want to see that happening to anyone else. Unfortunately, by that time, there was no really institution training advanced wound science in Kenya.
Yeah.
So I had to fly out where I got the knowledge from Maastricht University, Netherlands. I got the knowledge and came back a champion. Now, I tutor as well. I make sure I pass the information to others.
Yeah.
So it's a program which is open for doctors and nurses. They can come on board, specialize. I know there's a curriculum being done now, and soon even locals can be able to take the program. We get apprentices so that can be able, also we just locally give pass that knowledge to others, so they can be able to also deliver quality wound care services to the patients.
Right.
There's a lot of patients outside here.
Yeah. So you're also paying it forward. What you learned.
Yes.
All right. So I think I need us to paint a picture here. In terms of like what you do. Say for example, what do we call? Let's use burn for example.
Burn.
A burn. It's a wound.
Yes.
So, like, normally, how long would it take to heal, and what's the difference with what you do?
Burns, okay, that's broad as well.
It's also broad, yeah?
It depends on what extent, burns to what extent. So there are those degrees of burns. How deep has it gone to?
Oh my, okay.
Or how wide is it?
Yeah.
I know there are those which can easily be taken care of from home. Some you have to go to a facility. Some actually require even an admission. Some require even to go to theater so they can be managed quicker. So depending on the extent, but normally take precaution, especially in children and in the elderly. It's good regardless of how small it is to be seen in a facility. Okay. Yeah.
So I guess the better question here is how is advanced wound care different from, the previous approaches? Yeah. Using maybe an example.
An example.
Yes.
I'll take an example, for instance, a diabetic patient.
Right.
Those are difficult wounds to heal.
Yes. And
the notion outside there is that once you get a diabetic foot, it's done for you. As in end up with an amputation or complications which might be even fatal. But now we have procedures whereby after you clean the wound, you can connect a device which continues to remove anything unwanted from the wound and ensure it grows, the tissues grow and cover up quicker.
Okay.
So you don't need to see that patient even frequently. You put a device to see the patients once in a week. Yeah. So that machine continues to do your work even when you're not there.
Yeah.
We have these concepts like growth factor concentrates, they're injections. Okay, God built our body. Let me use that, built our body in a nice way that you have your own medicine. You have medicine inside you. These growth factors are available in the blood.
Yes.
So it's just to extract them and then inject them back. You concentrate them in one place. So you have a wound, you just concentrate these growth factors
Yeah.
and put them right where they belong. It helps tissues to grow quicker. So without science, you cannot be able to achieve what this can be able to do.
Yeah.
Even we do that even in coming to hair regeneration and loss.
I've seen
Hair
that.
is thinning down.
Yes.
Just inject growth factors to rejuvenate the growth. Yes.
Okay.
Just use of modern engineered
Yeah.
materials
Yeah.
solves the problems.
I like that. I like that there is. You touched on diabetic, especially wounds, because what we hear is it happens. That's it.
That's it.
That's it. Yeah. And when you talk about wounds, what exactly are we talking about? Could we maybe define what a wound is?
Okay. In science, we say it's a physiological injury that compromises the normal skin integrity.
Okay.
So anything, it can be even a bruise,
Yes.
a small cut. So as long as that normal skin integrity is compromised,
Yeah.
then that is a wound.
That's a wound.
Yes.
Anything that compromises the skin integrity.
Yes.
Okay. And what you do, does it also include like the scarring? Because also I think that's
That's another interesting field, scar management.
Yes. After the wound is healed, the scarring, because what would you
For scar management, also an entire field, a new field, we call it not under aesthetics.
Yeah.
Because you need to take the skin back almost to how it was before the injury.
Right.
It is important also in wound care. Now, science helps to prevent scarring. So when you're using these advanced materials,
Yes.
by the time the wound is healing, there is minimum scar.
Yes.
So you find that you wouldn't have to go back again and start scar management as per se. But it's also an advanced field. Some require surgical intervention. Some few patches put on top, a few injections here and there, and they help resolve the scar. We do that scar management because, remember, when the wound is healing, the integrity of the scar tissue is like 80%. It doesn't go to 100%. So it won't be normal skin.
Yes.
To mean any injury on it, normally it's going to be a bit difficult to manage later on. So taking care of them before they occur becomes an ideal issue.
We want to know, because there's one thing that Kenyans do, ni kukunywa antibiotic. For everything, we sort of just take antibiotics for everything. So I would like to know, what are the recommended guidelines for antibiotic use when you have a wound?
We don't give antibiotics anytime. So antibiotics, like you have a cut, you run take antibiotics.
Yes.
Remember, the body has got its own immune response.
Yes.
So we normally allow the body to fight. Only give antibiotics when necessary. For instance, those instances we find that a wound is infected. That's the only time we give local, not even oral or they're local antibiotics. So you put a dressing which has got antibiotic.
Yes.
So you directly give an antibiotic to the wound.
Yeah.
Not like this other guy, this person has to take in or maybe get injection antibiotics. So we'll only do that when this patient is manifesting signs of systemic infection.
Okay.
Now, the infection is spreading away from the wound, not even from the wound, away from the wound.
Yeah.
So that's when you give this person either
antibiotic.
oral antibiotic or IV. That's through the either injections. Local infection, just treatment with dressing material. We have dressing materials which contains antibiotics. So don't take it all narrows down to an assessment, how we do a proper assessment. So I'll encourage healthcare practitioners help patients do proper assessments and be able to see if it's local infection or maybe the infection is now getting systemic. That's when you can now be able to switch to give antibiotics. But don't rush to give antibiotics.
Right.
And also the public, antibiotic is not treatment like for a wound. I have a small cut you run over the counter. Also need to discourage the pharmacists and chemists from giving over-counter antibiotics.
Okay. And lastly, what would you say are the biggest challenges when it comes to wound management, apart from people leaving wounds uncovered?
This is broad, just both to the patient side and also the practitioner side.
Right.
I talked about a multidisciplinary approach,
Yes.
whereby you collaborate with other cadres, like you have a podiatrist, you have a vascular surgeon, a diabetic nutritionist. Remember, nutrition is also very important. So failure to incorporate this is a challenge.
Yes.
I get it as a challenge, especially when you're having referral.
Yeah.
Someone has come to with a problem which might have even been addressed by a nutritionist.
Yes.
But it wasn't done, so
Yeah.
it's a complication.
So the fact that there is a team, there should be sort of a team around a certain patient. Yeah.
Yes, so patients should be seen as a team.
Yeah.
That is one thing that we lack in the country.
Yeah.
The other thing, find that unfortunately in this era we still have those guys practicing some funny, some quacks.
Yes.
Putting very funny stuff. I had a patient who came with cow dung on a wound.
Oh my goodness.
And funny enough, this person was sent from a facility to go to a local woman who is a last resort. Like, this wound is not healing. Try that lady in the Kijiji there.
Yeah.
So that they come with even honey, with bees still, as in those orthodox method. There are challenges.
Cultural norms.
Yes.
Yeah. Okay.
So we're really trying to fight those ones. They're not in this era, everything is scientific. You need to have a rationale to what you do.
Yes.
So we get a lot of challenge from those ones. I wouldn't talk about finances. I know advanced wound care might feel expensive.
Yeah.
But remember, the cost of time that you're going to take to heal will make it cheaper in comparison to just doing the regular dressing changes. You'll end up like exposing yourself even to maybe infections and complicating the wound. So you can't say that advanced wound care is expensive. Yeah.
Right. Okay. And in terms of now, that's mostly the patient, and from the practitioner side, what?
Compliance.
Compliance
is remember, wounds don't heal overnight. So these patients need to keep on coming, even become social. It's like become free, because some take a little bit of time. Despite even using advanced wound care, there's that element of it won't heal overnight. So compliance, come on this day, they won't show up, either due to other factors like I felt pain, or maybe finances are not really right. I don't like that practitioner, I'm not going back. As in, they end up like complicating the wound status. And it's really a challenge. It's really a challenge. Also, maybe not taking care of, maybe not even taking the medications as supposed to. So patients also have a factor to play in when it's coming to healing.
Now, when we talk about wounds, I am sure there are so many types and categories of wounds that sometimes we don't even really think about. So I want you to walk us through the different categories of wounds.
It starts by a simple two categories, like a chronic wound. I'm very sure that term is very familiar. And then
chronic is familiar.
Chronic is familiar. And then an acute wound. So an acute wound is that one which is progressing on to heal. Like it's something called the healing phases. The phases of wound healing are continuous. So it's moving from the norms. Those normal sequences, they are following each other. The problem comes in when you're having now a chronic wound, because this process stagnates in one of the phases. So the wound fails to go to the next phase. And that is what normally brings a challenge. So the first category is just by splitting that into two, an acute wound or a chronic wound. The other categories now, falling under this one, is now according to the course. We have like 4 main categories under this one. So we have burns. Under burns also has sub-categories. We have trauma. Now under trauma, that's where we have things like you have cuts, you have bites, someone has fallen with a motorbike, surgical wounds, all those falls under trauma. It's really broad. Then you have underlying comorbidities like other conditions, wounds caused by other conditions, now like the vascular, blood related. For instance, we have the venous ulcers and arterial ulcers. If there's poor blood flow back to the heart, or there's poor blood flowing to an area, can lead to a wound.
Yeah.
Diabetic wounds, also those ones comes as a result of an underlying condition. You have even pathological wounds like malignancies, the cancer, everything. Then the other category now is because of pressure, not like blood pressure, like someone has been either sitting or lying in one position for too long. Can also bring about, I would have heard of bed sores or pressure ulcers.
Yes, yes.
So that is the last category. So each of them will still fall under those two, under either an acute or chronic.
Yes.
But you can also split them down further.
Okay.
Yeah.
So at what point do we say that a wound has moved from being acute to chronic? Is there like a timeline?
Yes. Yeah. We normally don't use the timeline per se, because we can reverse the process. You can make a chronic wound become acute. Then so you can't talk about a timeline.
Okay.
It's just a status whereby, let's say, a wound gets infected, it means it will stagnate. The phase is called inflammatory phase.
Okay.
So the body is in constant fight, trying to fight out this infection. Or maybe there are now dead tissues.
Yeah.
Or there's a lot of too much liquid, or let me use the liquid coming from the wound.
Yeah.
We have a different term for it.
Yeah.
So this status makes the wound to stop or to halt at the inflammatory phase.
Yes.
This is normally the second phase. So you see there are like two more to go. So the body halts the healing process. The body fights so that it can be able to go through this one.
Yeah.
So in this phase is whereby healthcare practitioners need to intervene. Apparently, the body has the capability to heal itself.
Yes.
So the job of a healthcare provider is to create a conducive environment that's going to facilitate the continuity of regeneration. Yes.
Okay. So we know that there are some wounds that take long to heal. Why? If the body is, self-healing, I would assume that we wouldn't need the care that you're talking about, because you say the body is self-healing. So why do some wounds take long?
No, there are two factors here. Some are intrinsic, to mean patient-related,
right,
and some is even the environment. And the environment also includes even the practitioner. So the patient, for instance, those are what we call intrinsic factors. Let's say underlying conditions, low immunity, some medications can be able to make even wounds not to progress on to heal.
Right.
For instance, we have patients on steroids. They won't heal quicker. There's lowered immunity, regeneration is a little bit poor.
Yeah.
So the body is not able to go through the inflammatory process. So healing becomes a little bit halted.
Yeah.
Factors now, like in the wound infection is the major thing that causes the wound not to progress or not to heal quicker. And then we have now presence of unwanted tissues in the wound. Those by default may happen, not because of the patient's fault, maybe just the nature of injury.
Yeah.
So you have dead tissues which needs to be taken out.
Yeah.
New tissues cannot grow on top of dead tissues. Yes,
right.
It's very practical.
Yeah.
Now, environmental factors or extrinsic factors, now you have like even the technique. How am I cleaning that wound?
Yes.
It might not be the appropriate way of making the environment, or what materials am I putting on the wound and make this wound even worse.
Yeah.
Yeah.
Okay. So, Dr. we've talked about, what you're doing, which I think is fantastic, using science to heal wounds, advanced wound care. But, I would want to know, at what point do I know, like, okay, maybe this wound I need to take to Dr. Kennedy, Dr. Omondi, like, at what point should I seek advanced wound care?
So there are several areas to check for.
Right.
One, any injury that there is prolonged bleeding.
Okay.
You're at home and this wound is still, you have a small cut, still continuous bleeding. Redness spreading around the wound. If that's turning red, that is around the wound, you're seeing redness. Change in that, at times normally this normal liquid leaking from the wound. If it changes its color, let's say it's turning yellowish or brownish, it's an alarm that you're getting an infection here.
Yes.
Persistent pain also suggests that you might need to to go to a facility. The other elements now is the size of the wound. It is a very common thing that we normally see. People might disregard a small ulcer, saying, okay, this will heal, I'll be able to manage this from home. I remember at times the cause, or maybe the cause of that injury, might expose you to even conditions like tetanus. That's why here you have a cut, come to the facility even for a tetanus shot. As in, it's important.
Yes.
So those areas that's mostly the basics that you normally check for.
Okay.
Yeah.
When we talk about amputations, most of the times they come from diabetic wounds, right? And something else that you've told me about called the venous ulcers. I want us to expound on that a little bit. Why does this happen? Yes.
We categorize them under lower leg ulcers as a result of vascular condition. Vascular to mean this element of blood circulation. So blood normally flows to the legs through an artery and goes back through a vein. So when there is anything preventing this vein to pump blood back to the heart, so to mean there is accumulation of blood into the lower legs, most of the times we're going to end up with this venous ulcers. So commonly those who will end up suffering persons whose occupation involves a lot of standing, either standing or sitting for too long. Unfortunately, ladies, because of tight clothing, can be able to prevent blood flow back. Cross-legging, those patients individuals keep on crossing their legs.
So that's not a healthy way to.
So you build up this pressure build up inside the veins. That's of your legs. You might end up with the venous ulcers, and healing is normally a little bit difficult if the appropriate care is not taken, because you need to restore blood flow so that it can be able to allow it to heal and not to recur, because recurrence is another factor. So
blood flow is really important when it comes to wound healing.
Perfect.
Okay.
Because that's what carries the building blocks for regenerating tissues.
Okay.
So you find that a patient, and they take long. I had a patient who had this wound since 1979, and they came to my clinic, and the first questions they asked, like, what new thing will you do that hasn't been done in 40 years? And so like, you didn't meet me. You haven't met me. So management is simple. You identify the vessel. It has to be restored. So that's why you normally talk about, in all aspects, a multidisciplinary approach. I won't be able to take care of these wounds alone. I need to involve other cadres, like the vascular surgeons. We need to identify this vessel. It has to be opened up. We talk about compression therapy. Compression therapy is you use a bit of pressure so that it can be able to enhance that flow back, prevent these legs from swelling and everything. So it can also be a preventative course, whereby your occupation is standing or sitting for too long. You can get yourself a compression stockings, so that it can ensure there is the right volume of blood at a time in the legs. So when it breaks up, also management, we do compression bandaging, which helps to reverse. So a lot of technique, and also do the growth factor injection to ensure tissues regenerate back, compress, they heal. For diabetic patients, that's a different ball game. Diabetic wounds heal, and no one should discourage these patients from going to a facility. Some say like, no, I was bewitched. Mtu aliniangalia vibaya and I'm having this non-healing wound. Glycemic control, have your sugars checked and monitored and regulated. Manage infections, ones who can be able to take care of the facility, give you the right medications to manage the sugars, infection, remove the non-viable tissues. If possible, just remove whatever is not viable, and then it will encourage the new tissues to grow. They heal quick. I've seen a lot of patients who've prevented a lot of amputations, and I think it's the right way to go. And also key people, I've talked about the multidisciplinary approach. Very important. We normally say, I cannot be with, there are these terminologies like, hey, this is my patient. No one belongs to anybody, as in. early referral is part of treatment.
Yeah.
Even I tell this a lot, especially those in the rural setups. Don't see a patient suffering and you're just trying to like, hey, we'll be able to just see something it's not within
My
your
area.
scope. This is not
Yes.
my area. Just send them to the right
Yes.
places. They're going to receive like good help.
Yeah.
Yeah.
Okay. So there's that question that we talked about that we hear quite often, whether wounds heal best when left open than when covered. So is this a myth or is it true? What's the truth?
I need to find the person who came up with that. You need to have a fight. According to science, wounds heal best when covered. Currently. Because we need to ensure there is optimum moisture.
Yes.
So there's a status which happens when it's left open, and it's normally not a positive attribute.
Yeah.
It dries out. And this drying out, not in the right way that the wound is healed, you've just altered the structure, you've taken away moisture from the wound, so the cells die and it dries out.
Yeah.
Unlike most statuses whereby you need to encourage until the skin forms on top, that is when you can say the wound is covered. So optimum moisture, this is only achieved when you cover the wound.
Yes.
You're going to prevent infection when you cover. You're going to prevent like even re-injuring this wound when it's covered.
Yes.
So in comparison, like if you put this patient in the status like one, you have two wounds, one is left open, the other one is covered. The one which is covered is going to heal quicker.
Faster.
Yeah.
So thank you so much. Like the information that you've given today has been so valuable, and I would just like to know where patients can find you.
Okay. I'm available at 40 Suites Upper Hill.
Okay.
That's it. Those who can travel or those who are in Nairobi. This is close to Kenyatta Hospital,
Right.
Hospital Road. On the first floor, 106. That's where my office is.
Okay.
Yes.
And on social media?
On social media.
I know you give a lot of free information.
Free consultation.
Free consultations.
K Medicine
Yes.
consult. K Medicine is KAY. Medicine, one word.
Yeah.
Then consult on all social platforms.
Okay.
Yeah.